Welcome to this EC2 TV program. I'd like to take you into the cycle of education care. In the Dutch Caribbean islands, the education laws state that all children, also those with special needs, should be catered for in the regular classroom setting as much as possible. This way the students stay in their own age group with their friends and peers, and the teachers receive coaching to optimize their lessons. Our teachers don't work with single groups of students of about the same level. The varying levels of our students, plus the absence of a special ed school, require that the teachers differentiate in their lessons. This means that they teach different levels at the same time so that all children learn. Of course, this calls for excellent classroom management skills of the teachers. All children can learn, maybe not with the same books or at the same level, maybe not at the same pace, but each in their own way. Differentiation can be done according to learning style, according to the degree of difficulty, or in time spent on a topic. The goal is that the students develop 100% of their own potential. For most children, the education system works, but at times a teacher tries everything by the book and one child still doesn't grasp it. Or sometimes a teacher encourages and praises her group, but one toddler is still acting up. And the subject teacher has prepared a wonderful interactive lesson, but 3 students are not interested nevertheless. What to do in these cases? Well, as of this year, a team of professionals is available to help teachers and parents in educating and raising your child. By doing so, we support the students. You may have met the experts or read about them in our newsletters. These specialists do not work full-time for the education system on Saba, and they are not employed by the schools to teach. They work for the Expertise Center for Education Care, the EC2. When the teachers need help with a certain student, these professionals are called in. It is their task to guide the teachers and care coordinators of the Laura Lindsay Daycare Center, the Sacred Heart Primary School, the Saba Comprehensive School, and the Social Youth Development Program. The specialists meet every month with the guidance officers of the schools in a group called the CART, the Care, Advice and Referral Team. All in all, we cater for about 325 students and 50 teachers. Teachers can get advice and coaching to deal with the issues they are facing. Also, as a parent, you can ask for the support from the CART and its specialists. Now let me introduce the team to you. Carmesita Chamon. She is a clinical psychologist from St. Martin, and she comes to Saba on a weekly basis. At times she even spends 2 days per week with us. The psychologist does psychological assessments. She gives counseling and psychotherapy to children. And if necessary, Dr. Chamon visits the schools for observations and she assists in behavior interventions. The psychologist works for the EC2 as well as for the Center for Youth and Family, and she also is a member of the CART.
So as a psychologist, I deal with mostly behavioral problems, but also social-emotional problems. And one of the things that I do as a psychologist is try to get a child, in this case children, because I also deal with adults, but in this case children, have the child change its behavior, especially if it's if this behavior is influenced by outside circumstances, the environment, or other people. And we do this in different ways. There are several methods where you could deal with kind of reward system, kind of encouraging the child to to show the desirable behavior that you want him or her to display.
Cheryl Ferreiro. She is the child and adolescent psychiatrist from St. Martin. She works on SEBA twice a month for 1 or 2 days. Dr. Ferreiro is a medical doctor specialized to diagnose and treat youngsters with difficulty in the thinking process, in feelings and behavior. She combines medical and social aspects with the developmental needs of children and their strengths. Cheryl Ferreiro works for the EC2 as well as the Center for Youth and Family, and she stays in contact with the CARD as much as possible.
As a psychiatrist, especially a child and adolescent psychiatrist, and being a medical doctor, I am involved with problems of the children once it is clear or there is a suspicion that there is more explanations for the problems than reactions to the environment or experiences. When there are indications that maybe there are also biological aspects involved, that's where I step in. The child and adolescent psychiatrist comes in everywhere when the child is not functioning as you expected, concerning the thinking process or the emotions or behavior, and it has to be complex again, and you suspect that there is more happening because otherwise it is already dealt with by the psychologist.
Desiree Coffey. She is our speech and language pathologist. She's from Bonaire. She travels to SEBA every other week for 2 days. The speech therapist diagnoses and treats children with speech and language issues. This can be in the field of the development of communication and vocabulary, but problems can also be of physical nature, such as issues with the voice and mouth, or with articulation and fluency of speech.
I'm here on SEBA, invited by Jet to do a screening by the students here in SEBA to see if it's necessary to do in-depth further assessment on the language, speech, hearing and voice part. While doing the screening, I go through a couple of sections that involves both language aspects, speech aspects, voice aspects and hearing aspects, and by doing that I can figure out if there might be any deficiency in one of those areas, and if so, if this is found out, then we have to do an in-depth further assessment to figure out actually what exactly is the problem, if there is a problem, and how are we going to handle with this problem to help the child who might have this.
Kim Teriele. She is our physical therapist. She resides on SEBA with her family. We can call on her when we need her advice. The physiotherapist helps and guides people with problems of the body, especially with regards to muscles and movements. Kim will be involved with the EC2 this year by screening the younger children of the Sacred Heart School.
I am Kim Teriele. I'm a physical therapist in the hospital, and for EC2 I'm going to observe some children and see if there are any problems occurring with their motor skills. Motor skills are important because the certain ages should go together with certain motor skills, and that's the same with the education. So that goes together for the overall health of the child.
If your child has reduced motor skills, we can ask him to help with personalized physiotherapy. Jet van Heinsbergen. Well, that's me, and I'm an educationalist and special education teacher living on SEBA. You can reach me every workday at the EC2. Part of my job is to manage the EC2, and part is to work with students from 4 to 24 years old to detect their learning needs, their strengths, and learning style. Based on educational assessments, I make a diagnostic report, which helps the teachers to work with special needs students. I also support the guidance officers and special ed teachers in making individual plans for the students. I am the president of the CART. For this year, we have also involved Angela Dekker in the EC2. Angela is a pedagogue specialized in the young child. She lives on St. Martin. An early childhood specialist, she is involved with the EC2 as a coach for the Laura Lindsay Daycare Center. We try to come to a government policy for early childhood education, and Angela does all that is possible to have good quality daycare. She communicates with me, the EC2 director, and other stakeholders. The EC2 also invites guest speakers who can give lectures and presentation on certain topics requested by the schools. How does education care work in practice? Imagine you have a child in primary school, and as a parent you're worried about your child's reading skills. You can get assistance in 5 steps. Step 1 is with the teacher. You discuss it with your child's homeroom teacher or mentor, and together you try to define the issue. You come up with options, also for the home situation. For example, as a parent, you will read all homework along with your child, and in school, the student gets extra instruction from the teacher. If this works, you keep doing it. If more action is needed, we take the next step. In school nowadays, we focus on what works. What are the needs of the child and what can the child do well? Who is there to help him? We praise the students to encourage them and keep them interested in learning. Step 2. This is with the guidance officer. The teacher discusses the issue with the internal guidance officers. All schools have a person responsible for organizing the student care. For the Laura Lindsay Daycare Center, that is Margaret Child. For the Sacred Heart School, teacher Jarmila is the guidance officer. Seba Comprehensive has Vanessa Wilson for the task. And Connie Atkins is the care coordinator for the Social Youth Development Program. The guidance officer thinks along with the teacher. She can observe the situation in class and give certain recommendations based on the methods used in school. The teacher and the guidance officer can fill out different checklists to define the request for help as precisely as they can. Ideas are discussed and tried out. If this works, they keep doing it. But if more assistance is needed, we can go to the next step. It always helps to talk to a colleague. The teacher describes the situation and the guidance officer helps to find alternatives. The guidance officer focuses on the teaching strategies and looks for materials that can help improve the child's performance. Step 3. Step 3 is in the school care team. The teachers can speak to the guidance officer whenever they have a question about the students. And once a month they meet in the school care team to discuss the progress of the students. The care team is meant for the teachers to help each other. The student's previous teacher can have an idea of what worked last year, or a colleague may have found a good book on the topic. The homeroom teacher tries out about 4 ideas throughout the next month. In secondary education, the mentor plays a key role in this. If this works, we continue doing it. If more guidance is needed, we take the next step. When the care team gets together to assist their colleague, we speak of intervision. The mentor or classroom teacher is asked to fill out a form to narrow down the issue and indicate what works. Key is catch them being good. The EC2 can help with a library full of interesting books and DVDs on a variety of topics such as learning disabilities and classroom management. Step 4 involves the CART. The guidance officer presents the case to the CART. The CART is the link to the experts. All internal guidance officers meet in the CART monthly together with the specialists who are most needed, the psychologist and educationalist. The speech therapist and psychiatrist attend whenever they are on island. Also, the Center for Youth and Family participates monthly. The CART looks for solutions. Who is the best professional to help with this issue? That person can observe the student. If the school asks for it, we do an assessment or test. In this case, parents will be notified by the school and asked for their consent. For instance, we can look into what causes the student to have a reading issue. More important than labeling the student as dyslexic, we look for what we can do. What are the options for this child in this situation? I give you some examples. Can the teacher use a different method of instruction? The educationalist helps to find the best didactical method. Is the student a visual learner? Or does he need a more hands-on approach with letter shapes? Should the teacher use phonetics and sound out all the words, such as k, a, t? Or should the teacher use a simultaneous approach and show the whole word with a picture, cat? Is the student not ready as yet for learning how to read? The psychologist can do an assessment to determine the level of ability. How is the child's memory? Is the student able to distinguish between and remember the letter signs and sounds? In case the teacher needs pointers about the behavior, the psychologist can come to do a classroom observation. Teachers may be asked to fill out a behavior checklist. Is the child able to focus his attention? Is the child willing to cooperate and follow instructions? All these things can be of influence on your child's learning. How can you as a parent be involved? Can you contribute? Can parents help the child read at home or do certain games? Does the student have a quiet spot for doing homework? Some children prefer to work alone, others rather work in a group. All children like to be praised for what they do well, but some need to be encouraged every 5 minutes. Others can work independently all day with a contract. The psychologist and educationalist make a report and discuss the outcome with the parents, the teacher, and the guidance officer. Based on the recommendations, the teachers make an individual education plan for the student. The student is allowed to work a tailor-made program, specifically catering for his needs. Also, the remedial teacher can be involved to give personal attention to the student. If this works, we continue the plan. If more assistance is needed, we take the next step. For every student who gets personal assistance out of the regular program, the school needs to have a plan that describes the goals, materials, and ways to measure success of the individual activities. Step 5 is with the specialists. Could it be that the student has a hearing problem, preventing them from following the instructions? Dr. Gijs Koot can be involved as the general physician. Maybe the child can't pronounce the words properly or has difficulty understanding the meaning of words. Then the speech therapist can do a test. The information goes back to the teacher and the parents, and the individual plan is adjusted. The guidance officer keeps helping the teacher to carry it out. If this works, we keep doing it. If more assistance is needed, we evaluate what we have done and make a decision together. Our expertise team covers the whole area of childhood development: physical, social, emotional, intellectual, personal. We can measure the child's ability to learn and to interact. We can measure the school achievements and language development, the emotional health and physical skills. However, in certain cases we can't avoid a trip to St. Martin or elsewhere. For instance, if a student needs glasses, or when a special medical examination has to be done. But when it comes to education on SEBA and your child's learning process, we can work together and act within a month to the benefit of teachers and students. This is how we strive for 100% learning for all. We invite you to the launching of our website ec2seba.org, and you can also follow us on Facebook. Please come see us in St. John's if you have any questions. Thanks for watching EC2 TV.